once again, we've got a patient who can't, or a client who can't turn their head comfortably to one direction. In this case, we'll say to the right. We get a good pre-test, so turn your head to the right. We want to see how far she can go and what it feels like when she gets there. An important thing to remember, besides just you checking how far she can go, is to have her acknowledge how far she can go. So when you turn your head to the right, pick something in your peripheral vision that won't move as far in the distance as possible. That's your visual reference, and we'll compare to that again when we do our retest. So let's say it was limited and uncomfortable. We did the towel snag as one option, but this lacrosse ball for the first rib is another good option. Lay down on your back, please. We're going to take this lacrosse ball and we're going to put it right where the neck meets the shoulder. In this case, turning to the right is the thing that's difficult for her, so we're going to put it on the right side. We're trying to target the first rib, which is very high up, very close to where the collarbone is, just in the back. So I'm going to take this lacrosse ball and I'm going to put it right where her neck meets her shoulder. To show you on the video, I'll do it on the left so you can see it. It's right where the neck meets the shoulder, and you kind of get just behind the upper trap. Don't go too much lower, you're getting into the lower ribs at that point. This is the upper rib. The way you know you're in the right spot is if when you do a bridge up, lift your hips up off the table, it should feel very pointy, it's pushing pretty severely on that spot. Do you feel that?
Yes.
Then if you turn your head, keep your hips up. Then if you turn your head to the left, it should get worse as you turn if you're on the right spot. Is that what you're feeling?
Yeah.
Okay. So let's do it. The video is for someone turning to the right, but let's do it on the left so you can see it nicely. So you've got your hips lifted up. 10 head turns to the left is what you'd ask your patient to do. We'll only do a couple for her. Then, once they've turned to the left, or turned to the sore direction, they can keep their head turned, and they can take their arm and lift it up overhead at the same time. That should make it even worse. Is that what you're feeling?
Yeah.
And then back down. So you can do 10 of those as well with your head turned. So head turn, arm lift, presses that first rib down even better. Sit back up again. So then we'll get her right back into that same position we started, and we're gonna have her do that same retest. For the video, we intended to have her turning to the right, but we practiced turning to the left. So let's just pretend we had done it on the right side. Now turn your head to the right again. She should be able to go much further and feel much better if we did it right and in the right spot.